You're listening to A Small Dose. I'm Dr. Charlene McCormick, a registered pharmacist, and I'm here to provide you information on medication treatments for various diseases. My goal with this podcast is to provide you the information you need about your medication so you can make informed decisions and be in charge of your health. Disclaimer: the materials and content provided in this podcast is intended for general information only and are not to be considered a substitute for professional medical advice, diagnosis, or treatment. Hello, and welcome to A Small Dose, where we aim to provide you with the things you should know about the medication you are prescribed. Today's Small Dose is all about fluoxetine. Fluoxetine is an antidepressant that is used to treat a number of mood disorders from major depressive disorder, OCD, panic disorder, bipolar depression, and premenstrual dysphoric disorder, better known as PMDD. I've read reports that state 1 in 10 Americans take an antidepressant, so I thought it would be great to talk about one of them today. Fluoxetine is available as tablets, capsules, and liquid, and is known by the brand name Prozac and Seraphim. I'd like to point out that Seraphim is only approved for PMDD. Fluoxetine belongs to a class of medications known as selective serotonin reuptake inhibitors, or SSRI for short. Serotonin is a chemical in your brain. It plays a role in many functions in your body, including affecting your mood, appetite, and alertness. It carries signals between the cells. In a normal cycle, it's released from a nerve cell for a short time in order to communicate with surrounding cells, then taken back up by the cell. Fluoxetine blocks serotonin from being taken back up, allowing for high levels to accumulate. It is believed that the higher levels lead to better communication, specifically leading to better mood regulation. When you are initially prescribed this, it will generally be started at 10 to 20 milligrams, and it may be increased after 1 to 2 weeks. It is usually taken once daily in the morning, but higher doses may be divided to be taken twice a day, first dose in the morning and the second dose at noon. The exception to this is if it is for bipolar depression. It is then prescribed to be taken in the evening. Fluoxetine may be taken with or without food. The presence of food will not have an effect on how much of the drug is absorbed into the body. When you are prescribed this medication, the main thing that will be monitored is your response. The onset is within a week, but the full response may not be seen for 8 to 12 weeks after you start taking this medication. It is important to be aware of the possible side effects, as these are key things for your doctor to consider when making dose adjustments or deciding to switch to a different antidepressant. There is an extensive list of reported side effects, but I just want to highlight the more frequent offenders. First up are gastrointestinal effects. Nausea, vomiting, and diarrhea seem like side effects for every medication, and they are ones that are reported for fluoxetine as well. This medication can also result in decreased appetite. Remember earlier I mentioned that serotonin plays a role in appetite regulation? Well, this is how that plays out for fluoxetine. Other SSRIs may affect your appetite in other ways. Next, let's address the reactions to your central nervous system. This includes insomnia, drowsiness, and anxiety. Yes, I know. How can this make me drowsy but then keep me from sleeping? I get it. But remember, these are possible reactions. This doesn't mean it will happen to you, or if it does happen, that they will all happen at the same time. Just know it's possible, and if it is happening, let your doctor know. Last, I'd like to mention a side effect that is common, but people like to hide or just don't feel comfortable talking about, and that's sexual dysfunction. Decreased libido is reported up to 11% in patients taking fluoxetine. Ejaculatory disorder and impotence were also reported. If you start to experience this after you begin treatment with fluoxetine, don't be shy. Let your doctor know so that it can be addressed. Lowering the dose or switching to a different antidepressant may be the answer. As a side note, fluoxetine has a long half-life when compared to other SSRIs. Half-life is a term used to refer to how long it takes your body to eliminate half of the drug concentration from your system. What this means to you is that the effects and interactions noted may persist for prolonged periods after you stop taking this medication. Next, I'd like to address some of the warnings that go with fluoxetine. All SSRIs come with a serious warning about suicide. Antidepressants have shown to increase the risk of suicidal thinking and behavior in children, adolescents, and young adults between the ages of 18 and 24 with major depressive disorder and other psychiatric disorders. It is important to take this warning seriously. You and your loved one should take measures to recognize this and set up appropriate safety measures. If you begin having suicidal thoughts, please reach out to a medical provider, the National Suicide Prevention Lifeline, or someone you trust to get you help. Serotonin syndrome is another warning I'd like to mention. Remember, the purpose of taking this medication is to help raise the levels of serotonin. Well, sometimes too much of a good thing can be bad. Serotonin syndrome can happen when the serotonin levels get too high. Signs that you may be experiencing this include confusion, loss of muscle coordination, fever, dilated pupils, and rapid heart rate. If you notice these symptoms, seek medical attention. There is not a single test to determine if it is serotonin syndrome that you are experiencing, but your doctor will rule out other causes. It is important not to ignore these signs, as it can lead to life-threatening things like seizures or irregular heartbeat. If you start other medications that affect serotonin levels or increase the dose of the medications you are already on, make sure to look out for these symptoms. Since I mentioned other medications that can affect serotonin levels, let's move on to interactions. What's important is that you take caution when taking other medications that can affect serotonin levels. These medications include other antidepressants like SNRIs, MAOIs, or tricyclic antidepressants. Also, anti-migraine medications like Imitrex, anti-nausea medications like Zofran or Reglan, or even pain medications like Tramadol and codeine. This is not an all-inclusive list, but just a few examples. Also be aware that herbal supplements like St. John's wort can increase levels as well. I can't give you a complete list of every medication that can interact with fluoxetine, as I don't think anyone would have the patience to listen to that. So if you are unsure if your other medications can affect serotonin levels, the simple solution is to ask your pharmacist. Many people ignore over-the-counter medications for potential interactions because they are generally deemed safe, but they can interact with your prescriptions. Dextromethorphan can be found in many over-the-counter cold medications, and it can affect serotonin levels. Also, NSAIDs like ibuprofen and naproxen can increase your risk of bruising and bleeding when taken frequently with fluoxetine. Now, I always end these talks with a discussion about cost. Medications can't be effective if you can't afford to purchase them, so let's look at your options. Fluoxetine is available in generic formulations. The generic version costs between $2.40 to $5.50 per capsule. The brand Prozac will run from $17.75 to $36.50 per capsule. The range is due to the different strengths that are available, so the lower strength capsule will be on the lower end of the cost range, and the opposite is true of the higher strength capsules. Remember, Seraphim is only approved for PMDD. Brand Seraphim costs $23.89 per tablet, and the generic version is about $16.25 per tablet. These prices are based on average wholesale price, so the actual cost to you may vary depending on the pharmacy's pricing or your insurance coverage, but this will give you an idea of what to expect. So that concludes today's talk. I really hope you enjoyed your small dose about fluoxetine and found the information helpful. Tune in next time for another small dose. Look for us on Instagram, Twitter, and Facebook. Check the description box for links. And as always, leave a comment if there are any medications you want to learn more about. I'm Dr. Charlene McCormick, and thanks for listening to A Small Dose.